Thank you, Purvi Madam, for giving me this opportunity to be a part of your IC. But anyway, this subject of the ethics for the sound practice development is to my heart since long time, because probably ethics, following the ethical practice only gives you the contentment in the life, for which I'll be talking for next few minutes. And now, because this was absolutely lunchtime, so few might have had the hypoglycemia causing the sleep, or somebody might be hyperglycemic causing this. So I said this is the thing can come out with the, for an awakening exercise for all of us sitting here. That's fine. So ethics and the morals is highly subjective thing, as I have always felt, And what I feel ethical, somebody may feel is to be, it's not an ethical thing, and the morals is again a very individual kind of a thing. So advertising cataract surgery with 6'6", advising someone a cataract surgery at a 6'6" vision who is, say, 70 around age of years, are we ethically right? I think that's something that we need to understand. Because in the current scenario, in the scenario of the usage of the social media, everybody is doing a lot of blah, blah, blah. And so effectively, and everybody starts feeling that unless you do blah, blah, you are not a sellable commodity. But I think sales is not the only thing for us to understand, but it is something beyond that, is the contentment and doing the good job for, because you are dealing with the patients as a human being and you are not dealing with the machines. So there is a mind inside the body, and that has to be addressed, that you are looking for the patient as a human being. Society and the medical fraternity, gone with the wind are the days where our predecessors have enjoyed the highest level of to being a god, or next to the God, almost, kind of a thing. And now everybody, the society members look towards us with a lot of suspicion. And but then finally we need to understand who started this. Ek haath se to tali bajti nahi hai, but then somebody might have started it and ignited the current through which this has started, and because of which now everybody in future is going to face these consequences. And probably just before going on the next slide, I think COVID for all of us was a golden era to prove ourselves that the medical community is doing a sincere job. But unfortunately, there are a lot of hospitals which you might have come across to know in the newspapers that whether the biosimilars were given or not given, because that was one of the very expensive injections at that point of time. So honesty, the compassionate ground, and the most important is the transparency at work. Because somebody advising some cataract or for the open angle, I come across sometimes that somebody has advised the laser PI and everything, and then patient sometimes comes, sir, I could not do it, and now am I going to land into the problem? And then you realize that somebody has already advised for the laser PI for the open angle. So I think what we need is the stewardship towards our work, and which is the most important thing to maintain the nobility of our profession. Unless we maintain the nobility, the society will always look towards us with a lot of suspicion. And are we really deviating from our oath? Because what has happened in the current scenario is people have started thinking that I am attached to this big institute, I am attached to that big institute. But all regards to one of the mentors is Dr. Usha sitting here, that she always confidently says that I am a solo practitioner in a city like Mumbai. So I appreciate her way that she carries to say that I am a solo practitioner, and I am also a solo practitioner, but then recently joined by my daughter also. So various different business models can be thought of, but then finally ethics will continue, and corporate owned versus the doctor owned hospital, because I have come across few of the doctors, those who were trying to be ethical, and then finally they were told ki since your cataract outcome is less, so now probably 3 months down the line we are noticing that your cataract outcome is less than 10%, 20% every month. So better that either you improve or you perish yourself. Improve or go out of this institution, because you are not supporting to the institutional the revenue generation. And all this started probably once the MBA people have started taking over the doctors as a management side. So doctors started themselves withdrawing out of management, where I have a lot of things to be on the management side also. I have come across, because few of the professors are sitting here, then they can always be the part of this, saying that public-private partnership model, which I am trying to propagate in Maharashtra, but then unfortunately in the current political scenario I am not able to follow up this dream of PPP model. But if they can be of some help, or she's also there as a professor, that we outsiders have some set skills, and the government can invest into the instrumentation, and we go inside and operate it, something of that kind. And otherwise, because unless we start thinking in the different business models, everybody, because finally end of the day it is all that how much money with a reasonable outcome that you take for the amount of the investment of the year of the life you have spent into the learning. So this becomes the most important thing, which probably might be the reason to deviate from the oath of the service to the humanity. So what we have to introspect our own self, accept the corporatization. I don't deny that corporatization is going to go out, but then accept in a graceful way and be, because the moment the mall started coming in, people started thinking that the grocery vendor who is next to you probably will disappear, will get perished. But this has